Hello. In the next few slides, I'm going to give you a brief idea about what osteoporosis is, why it is relevant to us, and what steps can we take to prevent it. My name is Dr. Ravi Bharadwaj, and I'm an orthopedic surgeon. What is osteoporosis? This is a fundamental question which we need to understand. Very simply put, it is a reduction in the bone mass per unit volume. It is different from osteomalacia, which is different mineralization of the organic matrix, which means the bone density is okay, but the qualitative uh, composition of the bone is defective in osteomalacia. But in osteoporosis, the bone itself is less dense and therefore more weaker. If you take the structure of the femur, the upper thigh bone, if you look at this part, and if you look at it under a microscope, this is how a normal bone would look like. These are the different types of interdigitating trabeculae, or a network of the various lamella which are laid down in the bone. Whereas if you look at osteoporotic bone, you will notice that the spaces are wider and more thinner, and this bone is more brittle and prone to fracture easily. So osteoporosis, in other words, is simply reduction in the mass of bone per unit volume. Let's talk a little bit about the disease burden, why osteoporosis is important. Here is some data from Indian studies. 50% of the women and 25% of men over the age of 50 years will have an osteoporosis-related fracture in their lifetime. That's quite frightening. 230 million Indians, majority of them women, have osteoporosis, and 50 million more are at risk of developing osteoporosis. It is expected that 6.26 million fractures by the year 2050 can be attributed to osteoporosis. So that's quite a significant disease burden, which is the equivalent of using drugs called bisphosphonates. So the types of osteoporosis are type 1 osteoporosis, which is also called postmenopausal osteoporosis, which is characterized by increased bone loss from the skeleton, and it's treated by drugs such as estrogen supplements, raloxifene, calcitonin, and bisphosphonates. Type 2 osteoporosis affects people over the age of 65 years and is also called senile osteoporosis, and it is characterized by reduced bone formation. So the bone is not formed at the same rate as it is being lost from the skeleton. This is treated by hormones such as parathormone and also with calcium and vitamin D supplements. So there are two different strategies for two different types of osteoporosis. The signs and symptoms of osteoporosis, well, you could have no symptoms at all. That is why it is called a silent killer. You could have localized bone tenderness in the skeleton. The patient could complain of back pain and a stooped posture, or they could complain of fractures with very trivial injury, and these are usually seen in the back and the wrist and the hip. These are called fragility fractures. So you could have either a vertebral fracture or a hip fracture or a wrist fracture. These are the common fragility fractures. Diagnosis: it is important to remember that X-rays and ultrasonography are not reliable for the diagnosis of osteoporosis. A DEXA scan is a special type of X-ray and is the most reliable. It is also called BMD testing or bone mineral density testing. Who should have a bone mineral density test? Anyone with a fragility fracture should have a BMD test. All women older than 65, postmenopausal women younger than 65 with significant risk factors, and men over 50 with significant risk factors should have a BMD test. Which brings us to the next question. What are the risk factors we are talking about? Well, the risk factors, some of them are estrogen deficiency, smoking, family history of osteoporosis, low calcium intake, vitamin D deficiency, lack of exercise, sedentary occupation, increased age, rheumatoid arthritis, hyperthyroidism, and people on drugs such as corticosteroids or anti-epileptic drugs. These can cause osteoporosis. Prevention is always better than cure. How do we prevent osteoporosis? Well, we can always ensure that we have adequate calcium and vitamin D intake in our diet, and we exercise moderately at least 3 to 4 times a week for about 20 minutes to 30 minutes per day. 3 to 4 times a week should be sufficient. There are specific medications for different types of osteoporosis, and these may be classified under various headings. There might be calcium and vitamin D substitutes. There might be drugs such as bisphosphonates, hormones such as calcitonin. There are other drugs such as selective estrogen receptor modulators, hormones such as teriparatide, and other drugs such as denosumab. These are all very specialized indications, and it is better to consult your doctor to understand which type of medication is suitable for your particular type of problem. In conclusion, it is important to remember that osteoporosis is a silent killer. Awareness is key. A healthy lifestyle and prevention is very important, and BMD test is a must at all at-risk individuals. Appropriate medication and healthy exercise and lifestyle can prevent osteoporosis. So, in conclusion, stop osteoporosis now and don't let your bones age faster than you. Stay healthy, stay happy. Thank you very much.